Obesity can be assessed using the body mass index. Basically, the BMI is a ratio of the weight to the height. So a patient comes into the clinic, you take the patient's weight in kilograms and you divide that by the height in meters square. If the BMI is greater than 30.0, we will classify the patient as having class 1 obesity. If the patient's BMI is greater than 40, we will classify the patient as having class 3 obesity or morbid obesity. The obesity can be assessed using anatomic differences in fat deposits. So basically, you can look at the patient's structure and you can determine that the patient has obesity. Men usually present with android obesity, also known as apple-shaped obesity, while women present with pear-shaped or gynoid obesity. So with apple-shaped obesity, there's excess fat on the abdomen. It's common in men, and it's significantly related to a metabolic syndrome. While with the pear-shaped obesity, there's excess fat on the thighs and the buttocks. It's common in women. It's not significantly correlated with a metabolic syndrome. Also, when you're looking at anatomic differences in fat deposits, we can use a measure of the waist to the hip ratio. So you take the waist, the circumference of the waist, and you divide that by the circumference of the hip. If it's greater than 0.8 in a woman, then she has more visceral fat stores. And if it's greater than 0.9 in a man, then he has more visceral fat stores. Other assessment of obesity can be looking at risk factors and the presence of obesity-related diseases such as diabetes, hypertension, metabolic syndromes such as hyperlipidemia, Cushing's syndrome, and coronary artery diseases.
So, for lifestyle modifications, I wanted to introduce it in a way that we could educate our patients. To do that, I brought in a study from a local professor named Dr. Stephen Alardi. He has tested and stands by a concept he refers to as therapeutic lifestyle changes, or TLC. Now, TLC is the idea that by making very small changes to your life, you can live a happier and healthier life. Things like biking to a friend's house rather than driving, or choosing to eat omega-3s over omega-6s. The important thing about these changes is that they are not instantly rewarding, but when you maintain them, you see the results, and that is what makes it a lifestyle modification. Our book echoes this idea by giving us 4 main types of lifestyle modifications, the first of which is to set goals, but to make sure that the goals are small and obtainable and can be built upon later. The second is self-monitoring and strategizing to maintain the changes you or the patient have made. The third is to exercise. As muscles work, they burn calories. The more muscle you have, the more calories you burn. The more you run, the more calories you burn. This is all just to put you in a caloric deficit that burns at those fat stores. The last type of lifestyle modification is dietary changes. These vary per diet, and not every diet is right for every person. But the main goal of these dietary changes is to put the dieter into a healthier lifestyle and a routine that they can follow.
Medications used to treat obesity include gastrointestinal lipase inhibitor. This medication diminishes intestinal absorption and metabolism of fats, particularly triglycerides. Selective serotonergic 5-HT2C receptor agonist stimulates central receptors, which causes appetite suppression. GLP-1 receptor agonist mimics the effect of ingredients, resulting in delayed gastric emptying, thus curbing appetite. Sympathomimetic amines stimulate central noradrenergic receptors, causing appetite suppression. Dual agents. Each of these medications combines 2 medications with known anti-obesity effects, and when taken together, they work stronger. An example of this would include naltrexone and bupropion. These inhibit central opioid receptors and inhibits reuptake of dopamine and norepinephrine selectivity, resulting in diminished appetite and cravings.
As an alternative to surgery, some patients may choose to pursue minimally invasive procedures. These interventions include vagal blocking and intragastric balloons. Vagal blocking is the placement of a pacemaker-like device into subcutaneous tissue in the lateral thoracic cavity with two leads that are implanted at the gastroesophageal junction. For 12 hours a day, a pre-programmed pulsating signal is delivered, causing intermittent blocking of the vagus nerve, resulting in diminished gastric contraction and emptying, limited ghrelin, and diminished pancreatic enzyme secretion, which causes increased satiety, decreased cravings, and diminished absorption of calories. Patients need to be educated on charging their device twice a week for an hour. Adverse effects include heartburn, indigestion, and belching. The next intervention is an intragastric balloon, which is the endoscopic placement of a saline-filled balloon or dual balloon into the stomach. The mechanism by which it results in weight loss is not fully understood, but thought to be related to increased feeling of satiety and decreased gastric emptying. The device should remain in place for 3 to 6 months. The adverse effects include nausea, vomiting, and balloon rupture. Balloon rupture can lead to intestinal obstruction and can be monitored by inserting methylene blue into the balloons. When a rupture does occur, it can be indicated by green urine. Also, leaving the gastric balloon for more than 6 months increases the risk of rupture. Patients who seem unlikely to return for follow-up appointments should not be considered candidates for intragastric balloons. As an alternative to surgery, some patients may choose to pursue minimally invasive procedures. These interventions include vagal blocking and intragastric balloons. Vagal blocking.
NCLEX question number 1. How do anti-obesity medications work? Select all that apply. If you want to pause here, I would go ahead and do so if you wanted to test yourself. The answers include A, B, and E. C and D are incorrect because medications do not increase peristalsis. They also do not supply the correct nutrients for the body, so the body still does need food and the correct nutrients to survive.
The nurse at the clinic assesses a new patient with a history of diabetes and hypertension. She records a BMI of 42.8. How should the nurse classify this patient based on your knowledge of obesity classification? And the right answer is C, Class 3 obesity. A BMI of greater than 40.0 is classified as Class 3 obesity or morbid obesity.